We get better each day through our commitment to learning creative solutions for improvement, including collaborating with other health systems. In 2016, Bellin began working with 6 Wisconsin health systems to improve the process and care for total knee replacement, leading to the formation of Bellin's Total Knee Improvement Team. The Bellin team's work has progressed to where it is now possible for many total knee replacement patients to go home on the same day as their surgery. It's why they are this year's recipient of the Values in Practice Award for Continuous Improvement.
In the beginning, we really looked at how could we really get our length of stay down on our total knee types of patients.
It was a culture shift from the expectation that everybody went to a nursing home after a total knee replacement.
For us, it was trying to get people home the same day as their joint replacement. And so there were a number of different things that needed to be set up in order for that to become a reality.
And this team was a multidisciplinary team we put together to look at our gaps from the patient experience, from the staff experience, as well as the surgeon experience. And this team came together and defined those gaps, created action plans, timelines for that. Specific improvements that we worked on was a lot of preparation for the patients. Setting the emotional and physical state of these patients before they come to surgery and educating them on the process was key.
I think for the improvements that we had to change, the first and I think one of the biggest critical things that Dr. Conrad Kleist would mention would be anesthesia. It was a big change, the way that they were doing the medications to make sure that those patients were moving quicker.
So making sure that we preoperatively have something on board so you're not coming out of surgery, that spinal anesthesia is not wearing off, and then you're in great amounts of pain and we're playing that catch-up game. So we really changed around our preoperative medications.
So some of the advantages of the same-day knee replacement is, I think, just the confidence and the comfort for the patient to be at home recovering. You know, we've seen that the patients do very well, and I think just being home with their loved ones in an environment that they're comfortable being in.
And so we have followed our data very closely over the course of the last number of months to ensure that those individuals who are going home are not seeing increased rates of falls or complications such as readmissions for other diagnoses.
Right now, I believe we're at 72% of our patients that have a total knee replacement are discharging same day. When we started, our discharge to home was 64%. Our discharge to home now is, I believe, somewhere between 90 and 95%. And of those patients, 72% are discharging less than 10 hours.
I'd like to thank my partner, Dr. Ken Kleist, as well as our 2 advanced practice clinicians, Elizabeth Summers and John Berge. They are excellent team members, wonderful colleagues, and it is a joy to work with them every day. And then, of course, you know, our Bellin Health joint replacement team, which there are so many members out there.
I think who I'd like to thank is our team. You know, and by team, I don't mean our clinical team, but our team as a whole, the healthcare system. I think what they have done to support us, all the other team members within the system, to be willing to come together for our patients is gratifying.
So I just want to say thank you to my entire team. They've made this improvement process so easy. And that's the beauty of it, to have good people to work with and understanding that we're doing what's best for our patients.